Hello, and welcome to Paeds at Ease, where we put you at ease about all your children's needs. My name is Dr. Sandra, and I am a pediatrician. Join me today as we talk about a topic really near and dear to my heart, and that topic is breastfeeding. I would encourage everyone to watch this video, whether you're a cool uncle, a rich auntie, a grandpa, a grandma, a father who wants to support his wife, or just an inquisitive neighbor who just wants to learn something new. Learning about breastfeeding is best for the whole community so that you can support moms who have chosen to breastfeed. The more everyone knows about breastfeeding, the more supported the mother is and the easier the journey. So these are 5 things I wish I knew before I started breastfeeding my own children. And just to let you know, knowledge as a healthcare professional doesn't really help that much regarding breastfeeding. That's why sometimes one can go to one's doctor or one's nurse and get conflicting information about breastfeeding. Please note that these healthcare professionals are really trying to help you. However, in our medical training, we focus a lot more on pathology rather than the normal child. So we tend to just give advice based on the best knowledge we have, and I'm sure your doctors are trying to do the best for you. But if you feel that you need more information, keep looking for more information and keep checking your sources to make sure that they are trusted. Onward to my list. I'm going to be using my notes in order not to forget. So these 5 things that I wish I knew before I started breastfeeding. 1. Breastfeeding can be really hard. I did not know that I didn't know, and my first experience breastfeeding was initially really extremely painful, and the worst was the shock of it. I did not expect to struggle so much, and I found that there were a lot of mothers who also didn't expect to struggle so much. I had compared myself with mothers I'd seen at church, mothers I'd seen in different places who looked as if breastfeeding was so easy. Oh, thank you, Hadida. Anyway, back to our topic. So, my first experience, my baby latched really badly. I had pain, I had discomfort, I couldn't actually breastfeed until, and what was worse was that no one wanted to help me because they said, "No, you're a doctor. No, you're in pediatrics. You should know what's happening." And I said, "Please help me. It's much different treating a patient and when you are the patient yourself." And I didn't expect this, so I didn't know that this was going to be hard for me. So I would like to tell you from my own experience and from other people's experience, breastfeeding can be hard. This doesn't mean that it's impossible, but it can be very hard. And if it's hard for you and not as easy and smooth as you expected, please note that that is normal. I tend to think that breastfeeding is a taught skill. The baby doesn't really necessarily know what they're doing, and you also need to learn. You may need to learn how to latch the baby. You may need to learn the particular baby's nursing style. You may need to learn things about the fact that it may take longer than you think for the baby to latch properly. So do not put too much pressure on yourself if the initial breastfeeding journey is not as beautiful and natural as you expected. Just because breastfeeding is natural doesn't mean it might not be difficult. If it is easy, that is wonderful, and I thank God for that. But if it's not easy for you, please know that you are supported. My second point, breastfeeding requires support. Please note, it is very difficult to sustain a breastfeeding journey when you are trying to do everything alone. You need help, and that is why everyone around you needs to know that this is something you need help with. I have a 6-week no housework rule. For the first 6 weeks of the postpartum journey, please don't do any housework. That might sound controversial, but I feel that it actually assists in the time that you need for bonding, the time that you need for rest, the time that you need to just actually enjoy your baby. First 6 weeks, no housework. Ask for help, for people to come and help you cook, come and help you clean, come and help you do everything, so that you actually have a time to sit and rest and actually get to learn this baby, because the baby keeps changing. The baby in the hospital is not the baby that was at home in the first 5 days, the first 10 days, the first 3 weeks. In fact, the first 6 weeks can be incredibly difficult for many parents. So do not fear, get support. Do not feel that you are being unreasonable by asking for people to help you. This is normal. Most cultures actually traditionally have a set time where the mother was taken care of by her own mother or her sisters or her auntie. Every traditional culture has this, and it used to be called, I think Americans called it the confinement time. Different cultures call it differently, but I know in Asia and in Africa it is really important to have a situation where the mother just takes time to rest in order to enhance this breastfeeding journey. You need support. Do not feel that you're unreasonable for asking for support. And for those who will likely never breastfeed but might support a mom, realize that she needs this from you. It's not her being spoiled, it is necessary. Third thing, you will need to eat. I do not think people understand how much you really need to eat. You need to eat about 1,300 calories extra while you are breastfeeding, especially in the first 4 months when you're when the baby really needs this full nutrition from the breast milk. Don't compromise on this. I always make a joke about, if you had a cow and you need milk from the cow, you don't just give the cow water. You give it grass, you give it specific salts, you give it everything it needs to help it make milk. Just like you're making milk, you have to eat. You have to eat a lot of food. And in most African cultures, you have to, and Asian cultures as well, there's tradition of eating hot food, hot cooked food. I'm not sure whether there's any specific link. I'm not sure about any studies about a specific link regarding hot food and breast milk production, but I have seen in myself that if I ate a full plate of rice and beans or something really hot and cooked, my breast milk would be very different than if I just ate a packet of chips or a sandwich. It really isn't the same. So comes back to my second point. You need help to get people to cook for you because you need a lot of food. So don't be worried if you find that you're snacking all the time or you're really hungry all the time. This is natural and normal. Your body needs nutrition for itself and needs nutrition for the baby. My fourth point, breastfeeding gets easier. It gets better and better and better as the days go by. It sounds like it's a mountain to climb, but once breastfeeding is easy, it is wonderful. And that's why some people can breastfeed for very many months and very many years. If your breastfeeding journey stops earlier than you'd like to, don't be discouraged. Just take time and always give yourself a chance to just relax, because breastfeeding works by a feedback mechanism. When you're stressed, the hormones that are released while you're stressed, the cortisol and everything, blocks the prolactin that is needed to release the breast milk. So whenever I find moms who are struggling with breastfeeding, I'll ask them, who pissed you off? Who made you angry? Who didn't give you food? When I answer those three questions, usually I find the reasons why the breast milk is low. When you find who's making you angry and irritated, forgive them, find a way to get them out of your life. Second, find a way to eat, find a way to rest. You need help, breast milk usually comes back without the need for supplements. You will not be able to increase your breast milk production with supplements alone. If you don't do the other things, the supplements won't work. They might work to some extent, but they actually won't work to a great extent. You need support, you need food, you need to rest, you need to be able to not be so stressed out, and the breast milk will flow and it will become easier and easier once all the techniques are done properly. And the fifth one, don't compare your breastfeeding journey to someone else. Some people will breastfeed for 3 years. Some people will only breast for 2 weeks. Some people, or rather, breastfeed for 2 weeks. Some people will only breastfeed for a month. And that should be fine. We would all like to breastfeed for as long as possible, but sometimes circumstances do not dictate that. Find a way to always have peace and always rather encourage people around you so that they don't feel discouraged about the choices they've made to feed their baby. The less stress you have, the more breast milk you'll have, the more you'll enjoy your baby, the more you enjoy the time away from work, perhaps for 2 months, perhaps for 3 months, perhaps for a year, whatever is possible in your country. So take time to not judge yourself, take time to not judge other people, take time to enjoy. Thank you.